All right, we're doing the blood vessels. We're going to start with the easy ones. This is the heart here. Now that's not one of them, but we can look for arteries, which are red. We can look for veins, which are blue, and then we can look for the easy general structures. The easy structures, I think, are the lungs, which surround the heart. In addition, you have the spleen, which is right down here. It's right kind of by the stomach. Almost looks like a tongue. So that's the spleen. You have kidneys on either side that you can say. And then you have the chambers of the heart. The chambers of the heart, it's the cat's right, so it's the right atrium, left atrium, I kind of twist it over, right ventricle, left ventricle. Then if we get into the arteries and we start working through our arteries and veins, we can go and we can start with the ones on the heart to begin with. Most hearts won't have the arteries and veins inject on the heart, but this one, it happens to show it. These actually feed the heart. This is my coronary artery, and right next to it, the blue one, is my coronary vein. On the back side of the heart, if they inject, you can see a cardiac artery on the back side, and you have a cardiac vein, which would be in blue, and I'm not sure that's visible. Now we're going to work through the blood vessels, and we're going to go through the veins first. Coming out of the top of the heart is the superior vena cava. The bottom side of the heart has an inferior vena cava. If we follow the superior vena cava on up, we hit the internal mammary right here. Back behind the lungs, if we pull this over, I can see what's called the azygous vein. It goes back down and around. It's kind of hard to see and the ribs are getting in the way. There are some intercostal veins coming off of that, going in between the ribs, the intercostal muscles. There are also some intercostal arteries. We'll get to those later. Keep following the superior vena cava on up, internal mammary, and our first split, every time we have a split, we get a new name. So my first major split, I go from superior vena cava to brachiocephalic. Next split, I go to external jugular. This is my right one. And then I'm going to go this direction, and I have what's called the right subclavian. This right subclavian is super short. It only goes from here to here. Then I get to the subscapular, and then I'm going to follow the main vein out towards the arm, and this is now my axillary vein. My axillary vein continues out, and again, not all of these look beautiful. This is kind of beat up, but they're there. Actually, I get past this stub about halfway down, it becomes the brachial vein. When I get to the elbow, then it's going to split into the ulnar vein, going towards the elbow and the ulna bone, and then the radial, going towards the radius, the radial vein. The arteries would be the same. If I bounce back towards the neck, I don't see their internal jugulars, so they don't have those, and there's nothing we can do. Veins tend to inject a little bit larger because this is thin-walled vessels. Arteries don't get quite as thick because those are really thick-walled vessels, and so we can't get as much latex to go into them. This up here on the top is my transverse jugular coming off this external jugular, and I would guess that that was probably my transverse scapular, but I'm not positive, being that I didn't pull it out originally. If we kept going up with the external jugular, once we get to the transverse, we would have the anterior facial, which would keep coming up this way. Theirs doesn't seem to have injected very well, but you can see the anterior facial. Now we're going into the abdominal cavity, which is below the diaphragm. Now I'm going to try to show as many veins as I can and arteries, but not all of them inject and not all of them are easy to find, and so there will be some on the list that I don't actually get to. We're going to start here with the inferior vena cava continuing into the abdomen, and we have a renal vein going to the kidney. That's an easy one to see. If I keep going down, we're going to hit what's called the iliolumbar vein right here. There's actually an iliolumbar artery next to it. Once this inferior vena cava splits, then it becomes the common iliac going towards each leg. The common iliac ends as soon as I get to another split, and there is an internal iliac going down right there, going deep, and then it becomes the internal iliac going deeper and the external iliac that keeps going. In between, way in the middle here, there is a caudal vein and a caudal artery that go towards the tail. Now I'm going to go back to the external iliac here, the vein, and when it splits again here, I've got the deep femoral vein, and I've got the femoral vein going towards and along the femur. That would be about it for the veins. Now we're coming back to do the arteries. Again, the arteries are very thick-walled. They're the ones that actually carry blood away from the heart when it's pumping it. We did the ones on the heart earlier, but now we're going to do the rest of the arteries. Coming out of the top of the heart, and I'm kind of twisting it over, but right here, coming out of the top is the ascending aorta. Then I've got a split off here called the brachiocephalic, and this is my aortic arch coming around the top. Then is the left subclavian, and then I've got my descending aorta going down that same main trunk. If I keep following it down, it becomes the thoracic aorta down here in the thoracic cavity until it hits the diaphragm, and then it'll become the abdominal aorta. Also in this area, we said before, we have intercostal arteries feeding the muscles between the ribs their blood. If I follow up and I go along with the brachiocephalic and I follow the brachiocephalic on up, it's going to split into the left common carotid, which comes all the way up along the neck, and it has a right common carotid, which is tucked underneath these veins, so it's kind of hard to find and see. I got to clean them up. There's my right common carotid. If I would follow that around more and get under those veins and really dig and look, I can find what's called the right subclavian. That right subclavian I can continue to follow, and it looks like there's a transverse scapular coming off here, although it's hard to see. This continues on its way. I have the axillary, and there should be a subscapular coming off, but I don't see it, so I'm moving on. When it gets down, it becomes the brachial down here, and then down by the elbow it should be, and I think if I pull the veins back I can see the ulnar artery, and I can see a radial artery going along with the radial vein and ulnar veins. If I come back over here, I'm pretty much done with the top. There's not much more I can do. They did not investigate all the ones going into the face, but there are a number of them. If they wanted to, they could dig deeper into the tissue and find what's called the lingual going towards the tongue. They could find an anterior facial, and they could actually find a temporal artery that is going towards the temples of the cat. Those are all in there if they follow these carotids, but this particular group didn't decide to do that. We're going to continue with the rest of the arteries. Now we're just inferior to the diaphragm, and so I'm picking up the abdominal aorta, which is this, it looks almost white. It's supposed to be pink and red, but it's really not. So here it is. I'm going to follow it on up, and it actually branches out here. It's hard to see them, but there's a number of them here. Just below the diaphragm is the first one I come to, and as it branches off, there's one that goes right up here, and it goes towards the stomach. Hard to see. It's pink. It's the first one going up. That's called the gastric. We talk about gastric things having to do with the stomach. If I follow out a little bit more, we get another artery that comes off right here, and it goes right into the spleen. It's called the splenic. If I follow this last branch out, and it's not easy to see, I can kind of hold it up, but eventually it goes into this pancreas here, this cottage cheese looking part, and then that is called my pancreatic, not too hard. This other one right over here is an artery right next to it. Again, they don't look super pink sometimes. So this is my superior mesenteric, which means if I follow my abdominal aorta on down and I get to the other side of the digestive organs, here's an inferior mesenteric. There are some I didn't talk about with the veins, but there are some that go directly underneath the inferior vena cava and the abdominal aorta. They go down to the lumbar vertebrae, and I can see them. If I pull this back, you can see there's some lumbar arteries and lumbar veins going straight down into the lumbar vertebrae. Below the inferior mesenteric, we said we have an iliolumbar artery and vein. They go to the side, so there's the iliolumbar vein, iliolumbar arteries right with it. I'm going to fall down to the split. At the split, we have the external iliac, and then inside, unlike the veins, we actually have the internal iliac right away. Again, this is not super clean, so there's some extra stuff on here. Internal iliac, external iliac. If I follow the external iliac on down, it's going to go to the deep femoral here and the femoral here. If I look on the internal iliac, it pretty much is done right there. It's hard to see the other parts of it, but the caudal artery should be way down in there, and that's pretty much it for the arteries.